All right, good evening, everyone, and welcome to the Somers Town Board regular meeting, starting here at 7:10, Thursday, January 16th, 2025. Before we start tonight's meeting, can everybody just stand for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Patty, you want to start us off with roll call, please?
Councilman Willie G. Faulkner.
Here.
Councilman Richard G. Clinton.
Here.
Councilman Anthony J. Sirica.
Here.
Councilman Thomas A. Garrity Jr.
Here.
Supervisor Rob Sperano.
Here. All right. All right, let's go right into public comment. Make the motion to open up public comment.
Second.
Favor?
Aye.
Move. Anybody here for public comment? If there's not, then I'll make the motion to close out public comment.
Second.
All in favor?
Aye.
Don't move. Patty, can we go department reports, please?
Turn it off too quick.
I have reports from Town Clerk, Building Inspector, Zoning Board of Appeals, Plumbing, Bureau of Fire Prevention, Planning and Parks and Recreation, Planning and Engineering, Tax Receiver, and Director of Finance.
All right, thank you so much. A little town board update, crosswalk. They were out there setting the crosswalk for the directions and the signal. And they just has to, DOT has to come out there and just give the final approval. So hopefully we'll have that. It is operational, but hopefully we'll get the final sign off here in the next couple days or next week. Tentatively, I'd probably like to do a ribbon cutting ceremony the following week after that. And looking at maybe the week of the 27th, preferably on the 30th of January. And we'll do a little ribbon cutting ceremony and have a little celebration for it.
Awesome.
Okay. I know it's been quite some time, but we're right almost there.
The weakest link.
Yep. Next up, we're going to have a little ad on here. Derek Anderson from Northern Westchester Hospital and Kiva Young-Wright from Northern Westchester Hospital are going to do a little presentation for us. So if you guys like to come up, that would be great.
Good evening, Supervisor and Town Board. We appreciate you having us tonight. My name is Derek Anderson. I'm the president of Northern Westchester Hospital. I've had the privilege of serving in that role since 2019, so the last 5.5 years. Kiva and I want to introduce my dear colleague, who's my deputy at the hospital, Kiva Young-Wright, who's an associate executive director, and Kiva also is the president of our foundation. We have a number of updates that we're going to move through relatively quickly, and also welcome any feedback or concerns. The reason we like to come and connect with you is to make sure that we're articulating what the vision and strategy is for the hospital that serves this wider geography. At the end of the day, we are a not-for-profit hospital, and we are deeply committed to making sure that we're serving the needs of this broader community. So we have a number of updates that, frankly, we're very, very excited about. One, which we're going to start out with, is related to mental health. It is no secret that before the pandemic, during the pandemic, post-pandemic, everything mental health has been a challenge and amplified, especially post-pandemic. We are right now launching an initiative specifically around adolescent and child mental health. It is known that approximately 50% of all adult mental health challenges start at the age of 15. So the idea is we're going upstream. We have partnered with many of our local school districts. Somers District is a part of our pilot program, already actively working with them and our peers at BOCES who administer some of this. And we are bringing child and adolescent experts into the school districts to work with and educate our teachers, administrators, parents, kids on how to recognize some of the signs of mental health. And then, but what do you do after that? Once you recognize that these kids are struggling with whether it be anxiety or depression, and there's many ailments that face us in mental health, where do you go? Where do you seek help? we are opening this late spring a center in Mount Kisco, which is like an urgent care center for kids. Where do you go besides waiting 6 months for a mental health provider to seek care? It will be a center like this. This is simply a rendering. We are grateful for many of the Somers community and the surrounding areas who have stepped up and helped us fund this. Mental health is an area that is not funded at any level within healthcare. It's a challenge, which is why a lot of organizations shy away from it, which is also why it then puts us in the situation of it being under-resourced in our communities. But we all are very well aware of the mental health challenges that we see every single day in partnership with a lot of our community organizations. So we are excited about this. This is a center, in addition to the school program, it is a center like an urgent care center that is staffed by child psychiatrists, social workers, nurses, and a team of professionals to help stabilize a child, to frankly prevent them from going into the ER. And if you've ever had a child in the emergency department, it's tough, especially when they're waiting 3-4 days for a adolescent or a child inpatient bed, which there are very few in the state of New York. So we hope this will help. This is just the beginning. We'd love to keep you updated as this progresses, but this is an initiative that will have kind of wide-reaching. There is a psychiatric practice. Remember, as a not-for-profit, we accept any, all, no insurance. So this is meant to be open to the community at large, despite insurance status. We try to remove any possible barrier that would prevent somebody from coming in and seeking the help that would ultimately prevent future illness. So I'm sorry to spend so much time on this one slide. I will go quicker through the other slides, but this one is just so important to us, and we are so excited. Kiva has been driving this project for 2 years with a few very key community leaders. And I don't know if I'm supposed to mention this, but Kiva lives in the town of Somers as well.
Good choice. That's it. To have you. We feel
Great choice.
safer because you're here.
So this has been her brainchild and her project for the last few years. We're excited that it's now starting to come to fruition, and it will save lives. And any child life that we are looking to save is, as we can imagine, it's worth every effort that we're going to put into this.
I thank you for spending a little bit more time on this slide. I mean, I think it's something that the town has dealt with, right, and mental health, and I know that we are going to have an offline discussion, you and I, on another time that we're going to sit down and we're going to get some more information about the program and how we can share the program with our residents here in the town of Somers. So I look forward to that meeting, that one-on-one meeting
Yeah,
that we're going to have.
thank you for that, Supervisor. And I know you were so gracious to accept that kind of clarion call a few weeks ago to say, can we meet, can we talk, and let's figure out how to partner. So thank
Well,
you.
I mean, I work a lot with high schoolers. Adolescent depression is huge.
It's huge.
A national epidemic.
Yeah.
30% of all girls say they've thought of or tried cutting on themselves.
Yeah.
Boys, not much better. A lot of people say it's a cell phone. A lot of people say it's this or that. I don't know. But, you know, it is something every school district has in front of it. And I'm sure whatever research help you can, especially if it's not funded at all, I think that's a very good thing. And let me just say this, kudos to your hospital, since I spent 5 days over Christmas in there with pneumonia.
Oh, no.
And let me
So
tell
sorry
you,
to hear that.
good.
Okay.
And Mr. Anderson, let me just say, the cafeteria was fantastic.
Okay. I will make sure the team is aware.
It
Thank
was
you.
great.
Yeah, the short rib on the menu is worth coming.
Avocado toast for breakfast with 2 perfectly poached eggs with berries on the side.
Oh, my God.
Oatmeal.
Finally got a home cooked meal.
I got it. They could have sent me home after 1 day, but I stayed 5. 'cause
You can't go back, Rich.
I was going to say this at the end, but
Yeah.
just in general, I'm a big fan of the hospital. I live probably closer to 2 other hospitals, and when my kids had anything or when I had anything,
Northern Washington.
we go to Northern Westchester.
We appreciate
So
Thank you.
you guys always do a great job. I've never had any complaints. I mean, I know you get complaints, I'm sure. I've never had any, and with 2 kids who are now older, you can imagine how much time we spent down there in the,
Yeah.
in the emergency room,
Yeah.
all that sort of stuff. But you guys do a fantastic job.
Thank you.
Well,
Appreciate it.
just now we're going to
My grandson was born there 7 months ago, and like all these things go, they go
Congratulations.
sideways once in a while.
Yeah.
But everything turned out well, and you guys did an awesome job.
Yeah.
Not only with the direct care, but sort of like the mental health care all around that. So great. And then one other point that Kiva served on the Partners in Prevention.
Yeah.
Maybe that's a point that may be a point of contact for some of the
Mm.
implementation of
It's,
this behavioral work.
True. Yeah.
it's a great suggestion. Thank you for that.
Now, how did the logistics work of this place? In other words, it's you said kids 15 and under predominantly or largely.
Yeah. 18. Yeah.
18 and under. How do they get there? They don't drive. I mean, they must be dependent on a parent or a coach or a teacher, who may or may not be supporting this initiative. How does that work?
Yeah, this work is not linear and it's sticky and complicated. The goal is to be as supportive as possible, as welcoming as possible. We're on a major bus line.
Mhm.
We intentionally did that. And the goal is to train these teachers in all of these 9 districts that have engaged with us on this topic. And every school superintendent, especially here in Somers, is enthusiastic to support this. It's not just, hey, here's the research, read the paper and come back. We're bringing teams into the schools to do evening webinars with parents, to do live seminars with teachers, role playing, active discussions, so that they are creating that environment where the kids feel comfortable saying, I think I have a problem, and what do I do? And then this gives the teachers and the schools a solution. Because we know the challenge is today, if any one of us were facing a mental health problem, we try to find a licensed clinician. Even us with access will probably wait several months. Those who do not have access, our goal is to really help focus on those underserved populations who have a hard time navigating, who may be either undocumented or no insurance. The goal is this program is all inclusive. So from the environment to the way we train people, all of the above, I think we're trying to just break down some of those barriers. Just by talking about it, it removes some of the stigma. Some of the issue is we don't talk about this public.
Yeah.
So we need to make it, it's amazing. I will go anywhere in the community. I'll be at a restaurant or at the grocery store. People will come up to me and they will tell me the most intimate details of their heart surgery or what happened with their orthopedic surgery. I've never had anyone ever mention something about mental health. They'll tell me about every other type of surgery and care, and I love that. But no one ever talks about mental health. So we are on a mission to destigmatize.
Now, I find that interesting in terms of on the evolutionary scale.
Yeah.
Would liken that to, unfortunately, cancer 50 years.
Yes.
Same.
It was
Nobody wanted to talk about it.
Yeah.
It's a darn good thing that we're talking about it. 20 years ago, the opioid crisis.
Yeah.
Nobody wanted to talk about it. There was a stigma. Darn good thing we're talking about it. So kudos and thanks for you guys to bringing this more to light.
Thank you. Appreciate that. So just if I may, we are actively planning to develop Northern Westchester as a trauma center. We hear this from our local VACs and fire departments that it is sometimes a burden for them to travel an extra 30 minutes south for the medical center, which is currently the only level 1 or of any level trauma center in all of Westchester and Putnam counties. There is one trauma center.
It's usually what, Grasslands or Yale?
That's it.
Yep. Okay.
So there are one point in this geography that I'm showing you on this very simplified map, Westchester and Putnam counties, there's almost 1.3 million people.
Yeah.
One trauma center, public health, it is not sufficient. Our neighbors in Fairfield County, there are 11 trauma centers for the same population density.
How do you get that status, though? Funding to do that?
So it's a kind of a multi-step approach. We have a regional trauma advisory committee, which serves the Hudson Valley. We have met with, presented, and spoken with them. They are unanimously excited and supportive of this approach. And just to be clear, we're applying for level 3, which is the lowest. So level 3 is the lowest with a neurosurgery designation. Level 2 is higher, and then level 1 is your Westchester Medical Center. We do not have an ambition to be level 1 trauma, but we want to be supportive of level 1 as a feeder for that more advanced. and bringing the care close to home. So after the regional trauma committee, we had met with the state trauma advisory committee. This is a New York State, it's based in Albany. EMS providers, trauma centers from all over New York State meet, they convene. The regional trauma committee recommended to the state committee that we become a trauma center. So we have their support. After that, we are applying to New York State for approval. And then along the way, we're working very closely with all of our local VACs and Westchester EMS to make sure that we're just doing it in the right way.
You're Northwell, right?
We are part of Northwell, yes.
So do they fund this at all, or
Absolutely, yeah.
You're Optum
is there
and
gonna be
North-
more building and brick and mortar that you're gonna need?
No, not really.
Okay.
Nope, a lot of it will house, a lot of the level of services offered at the hospital today. Think of advanced orthopedics,
Okay.
neurosurgery, stroke care, all of that is already being provided today. It's simply if an accident happens in front of the hospital, let's say in Mount Kisco, and we have every level of service to provide that care, that patient will get in an ambulance, likely with a volunteer ambulance provider, travel 30 minutes south to Westchester Medical Center in Valhalla, could be there for a couple of days. We often get patients that end up coming back to us because they were there for a couple of days and the trauma center was overwhelmed. So I think we're looking to have that broader public health view, make the investment in, let's get those services closer to us so that heaven forbid any one of us or, any one of our members of the community had an accident, that we're kind of providing that care close to home.
Thank you.
Are you Optum and North?
No, Optum,
Like they were telling me that they're
completely separate, but we partner a lot. So Optum is a medical group,
right.
a national medical group owned by United Healthcare,
Yeah.
for profit. Northwell Health is hospitals and ambulatory sites spread across the Hudson Valley, all over the city, Staten Island and Long Island, soon to be Connecticut. Very different. What confuses often is Optum acquired Caremount Medical,
Right.
which used to be the Mount Kisco Medical Group back in the day.
Right.
Because a lot of the physicians that are employed by Optum work in Mount Kisco and they are on staff at the hospital, sometimes the two get mixed up. We partner very closely with Optum. For us, they are good partners. The physicians, we're mostly working at the physician level. The physicians love working at the hospital. But they are two separate entities.
Yeah.
And you're non-for-profit?
We are a not-for-profit organization, yeah. So fundamentally, just different missions, and some of that plays out.
No, different mandate when you work in a profitable situation.
Yeah.
Gets a little,
Okay, if I'm
okay,
yeah, do you mind if I keep going?
Go ahead.
yeah.
This we can touch on quickly. The hospital is, as we speak, becoming a teaching hospital. We opened our first residency program. These are physician trainees. 107 years being in the community, we've never trained physicians. So we are becoming an academic training hospital. We had 3,000 applicants for our 16 residency physician spots. So it's remarkable. 16 very bright, exciting students. What this does is and you can see the programs on the right. Over the next 5 years, we'll be introducing about 100 physician trainees to the hospital. What that does is when they're ready to graduate and be done with their training, by that point, we will really, really encourage and build the relationships so they want to set up practice in our community. The reason for that is we know that physicians are aging out. So this creates a pipeline locally so that we're not always having to bring people in from the outside. We want to grow talent locally who are committed to the communities, like Keeve and I, who live locally in our community. So this is exciting. And this is kind of also raising the bar on the type of care and the level of care that's provided close to home.
But these are graduate MDs or
Yep.
nurses?
Physicians,
Physicians.
yep, MDs.
Yeah.
To graduate medical school. And then you have, depending on the specialty, you'll go into a residency program.
That's a residency program.
It's a residency program, yeah.
Got it.
So internal medicine is the base. That's like primary care.
Mm-hmm.
And then from there, you'll see surgery, OB, that's happening this year. These are surgical residents, OB residents. We want to make sure that in 25, 30 years from now, we all have enough physicians in our community who are rooted and committed to staying and practicing here locally so that we can continue to have access to great care. That's really the long-term vision on a program like this. Okay.
Mm-hmm.
All right. Quickly, we can go through that. These are a number of new providers that have entered the hospital community. We're excited for this. We can keep going. On the next slide, please. I am often asked, does Northwell, all of Northwell is not for profit, remember, does Northwell have any physicians? My physician retired, they left. I am asked every day of the week, including weekends, hey, I need somebody, it happened today, somebody needed an orthopedist. How do I get connected? A lot of people don't know this. We employ close to 300 physicians in the community, primary care, all over. You can see the map in all over these regions. So access to care is no longer limited to just one or two major medical groups. We have plenty of options for people to access that care because really, ultimately, we want to keep people out of the hospital. We want to keep them well and healthy so they can avoid entering the hospital. That strategy relies on us building practices out in the community. You can see where a lot of those are, including urgent care centers. Okay, next slide, please.
Have you spoken up at Heritage Hills?
Personally, no. We're kind of talking about it.
Probably should. Rob and I had the opportunity of, attending a Optum sort of meeting.
Yeah.
And as they're going through their transitions, it's created a lot of
Anxiety.
service issues.
Yeah.
They're working on it and they have a plan. But, what resonates with me is just the population of access to medical professions. I mean, in that whole profession, there's just not enough
Yeah.
primary care physicians and the like.
Yeah.
And so it's important.
Yeah. Thank you for that. Keith and I were just talking about this a few weeks ago.
Rob can probably give you contact up there.
Thank you.
All right, so right?
So Jay will also get us connected.
Got it in, okay.
Thank you to Jay Wright and thank you, Supervisor. Yeah. We can go through these ones fairly quickly. So this is, we just opened an expansion of our recovery units. So, right, this is every dollar profit that the hospital makes, every dollar literally just gets reinvested back in. That's the nature of our business as a not-for-profit. So a lot of capital projects, all of it just being reinvested back into the hospital. We want to make sure we're providing a comfortable, beautiful space for the next 50 years. So recovery expansion, the next one is an obstetrics modernization. If you were there 7-8 months ago, that unit is almost 40 years old. It is time for an upgrade. This is a big investment. This is almost $49 million. The entire obstetrics unit, as one of the busiest delivery units in Westchester County, we're excited to just make sure that we're modernizing and providing the best environment. The care delivered is high quality. We want to make sure the environment matches the level of care. The next one is the emergency department. Emergency services at the hospital have grown 17% in the last 4 years. Part of that is access to primary care and others who use the ER as their primary care physician. So we will be expanding the ER starting later this year. I think an important investment as the ER has just gotten incredibly, incredibly busy. And we want to make sure that we're still providing good quality personalized care. Okay. This is my last slide. There are so many different, this is just 4 of many ways that we engage with our community to make sure that we're staying connected to the pulse. We have advisory committees with former and current patients. We have a president's council that includes a number of leaders throughout the community that advise us on, have you heard this? Are you thinking about this? Don't do that. A lot of good kind of sounding boards that help us stay grounded. And of course, Somers is no different. We have many who come and serve as volunteers who keep us honest with providing the best care. And so for Keith and I, staying connected and local is really hugely important for us. And so if there is ever anything that you hear that we can be doing better, we want that feedback.
Derek, you did say something about that just resonates with me, you know, the emergency room
Yeah.
and I guess its use, I mean, you're getting a lot of emergency room, how do you just, in a sense,
Visits.
visits, right? Is that because there's an absence of service in other areas? You know, well, like maybe the emergency care services that are around here.
Yeah.
I mean, when do you go, you know, you have more people showing up to emergency rooms. Is there something behind that?
Yeah, it's kind of multifold. It's a national issue, not just local to us. Certainly, we're feeling it. The largest driver is not being able to access your physician off hours, or I got an appointment for 3 weeks from now. I can't wait, or my condition gets worse.
3 weeks is like tomorrow.
Yeah, or 3 months.
Right,
Yeah, right.
right.
Thank you for that. Yeah, touche. Like that's exactly it is, you know, and there are specialties like neurology care or urology care that sometimes you're waiting 6 months for care. And so people can't wait, which is why we're trying to build these teaching programs so that we're producing our own physicians as a community so that we can set up these outposts so people can access the care. But that's definitely the second biggest driver. The third is, unfortunately, many of our communities continue to age. The population is aging. Obesity rates, despite the New York Times article a few weeks ago, obesity continues to go up in the state of New York, which then translates into greater cardiac, neuro, stroke issues, unfortunately, down the road. So it's kind of a combination of all three of those, just access to care. It is a national issue, and that just the advancement of illness within the communities and the aging population.
Yeah, I mean, you just try to get an appointment with your primary and, you know, you're scheduling a lot
Yeah.
and then you have an emergency. And so I think they're altering to get access. But you find yourself jumping to the emergency room before as your first choice.
Or does urgent care, the urgent care is not part of the hospital or the Northwell. That is Optum's outreach, for lack of a better word. Yes?
Yes and no. Optum has a couple of urgent cares. We have 4 locations. They are called Go Health. You've seen them?
No.
There's one in the closest to here would be the Yorktown location.
Okay.
We're actively looking to put one in Mount Kisco, White Plains. There's one in Terrytown and New Rochelle.
So those places could be either their outreach from Optum or from the hospital
Those are
itself, which would keep people theoretically out of
Yeah.
the emergency room. That's where I started before I passed out. It's not really urgent care. It's we'll get to you sometime care.
yeah,
And so I was there a while until,
sure.
and then they said, maybe get this guy out of here.
Yeah.
But so that's the answer. There's some of each. And I guess it's a cost driver because the emergency rooms are really expensive.
Emergency
I
rooms
would-
are expensive, and it's just like some of our EMS providers. An ER is built for cost of rates, which is we're ready to take care if you're having an advanced
Yeah.
stroke or brain bleed,
Yeah.
all the way to somebody comes in and they have a cut finger, which, not to minimize, but we have to prepare for the spectrum of illnesses and everything in between. So when you look at the ecosystem of healthcare, you have a bunch of doctors' offices. You have a bunch of urgent care centers. You have pharmacies and places like Walgreens who have walk-in clinics, things of that nature. And then you have hospitals, and then you have bigger hospitals. And ideally, those urgent care centers were built, they started about 15-ish
Yeah.
years ago. The idea was to avoid ERs.
Right. Filter them out.
Our challenge is the other lever on the primary care side kind of fell apart to some extent. And so that's what's driving ER visits to go up despite more and more urgent care.
Really? Okay.
Yeah.
One final question. What are you seeing in birth rates?
Birth rates in this county are going down.
Still,
Yeah. Yeah.
My daughter's in labor right now.
Great.
Is she?
Actually,
Good luck.
Point.
no, we're
Good luck
our part.
wherever she is.
And all we hear about is you in the hospital.
Well, I deeply appreciate the opportunity to come. Thank you for letting us, Keith and I, present some exciting things on the horizon and some of the challenges that we're facing. We are always available to you as town leaders, as members of the community. Please, please do not hesitate to reach out. It gives us no greater privilege or pleasure to help people navigate the complexities of health.
You want to give us your home number so we can
Don't do it.
out
Do
on
it.
the table?
Office number.
Eva,
Yeah, no, don't throw
I'll
people
out
under the
every
bus.
We actually know where
Cat.
Eva lives.
Uh,
And we actually know your number, so we can go right knock on your door.
That's it.
Well, thank you.
Thank you.
Guys,
Thank you.
Like I said, you
Important work,
Thank you.
job.
guys.
Thank you for coming.
Really is.
We appreciate the time. Thank you.
Yeah, thank you for taking care of me.
Thank you. Oh, well.
All right, nice. Move right on here to the next topic. Number 2, Reach Park Angle Fly. And this would be to declared town board lead agency. In the January 8th meeting, the regular meeting of the town board, Somerstown Planning Board, they had no objection. It was a unanimous vote for us to act as lead agency. And then also the DEP had no objection for the town board to act as lead agency. And to give everybody just another update on this, this is for the proposed access road at Reese Park. So I'll go ahead and make the motion to declare the town board lead agency.
Second.
All in favor?
Aye.
So moved. Number 3 here, this is the award bid and authorize supervisor to execute a notice of intent for the Ross Drive Tank Rehabilitation Project in the amount of $520,500 to Moen Industrial LLC. And that was dated on March 9th, 2025 from Steve Robbins, PE Senior Technical Manager, Woodard and Kern Engineering and Geological Services. Steve, I know you're here. You want to give us just an update on this?
Title's more of a mouthful than the rest of the.
Yeah.
So the town last fall issued a bid for rehabilitation of the interior of the Ross Drive tank. That is the town's one water storage tank. About 10 years ago, the town undertook a rehabilitation of the outside coatings on the tank. The decision then was to split them up, spread the work out a little bit, and to spread the cost out a little bit. So we went out to bid for this project in the fall. Those bids were received in November. There were 4 bids received for the project. The low bidder withdrew their bid after we went through some pre-award machinations with them. But we are happy that Minoan was the next low bidder, and they appear prepared to start work on that tank in the spring, should the town decide to award the project.
All right.
Guys have any questions?
Nope.
Let's get it done.
Got to be done.
All right.
Hopefully we get it done before the summer, right? So all the
Yeah.
noise and,
Yep.
get it done.
Yep, it's a tight site, but the contractor is committed to working with the neighbors there, and we are as well.
Have you socialized it with the neighbors yet?
We haven't had a contractor to do so with yet.
Yeah, okay.
Yeah, and to let everybody know too, we did meet with Nolan
Yeah.
the other day on a Zoom. Come highly recommended with the references. So we feel that they're a fit for this project, and we did our due diligence in making sure that they had the expertise to handle the project. All right, I'll make the motion then to award bid and authorize the supervisor to execute the notice of intent for the Ross Drive Tank Rehabilitation Project.
Second.
All in favor?
Aye.
So moved.
Thank you.
Thanks, Steve.
I'll call you tomorrow, but I think we have it mostly drawn up. Thank you all.
Right.
Awesome.
Have a good
Thanks,
evening, Steve.
Okay, next one here, award bid and authorize supervisor to execute a contract for the demolition of 5 Cottage Place house and garage with Cobbling Rock Construction, the amount of $45,000. This was dated on November 21st, 2024 from Michael Dunbar, Assistant Building Inspector. This has been on our radar for quite some time. The building needs to come down and be demolished. It's a hazardous building. So we want to make sure we take care of it. We've had plenty of conversations about this in prior board meetings. I'll go ahead and make the motion to award the bid and authorize the supervisor to execute the contract.
Second.
All in favor?
Aye.
Aye.
Move. And then number 5 here is award bid and authorize supervisor to execute a contract for the asbestos abatement at 5 Cottage Place with Capital Industries in the amount of $101,000 per memo dated November 21st, 2024 from Michael Dunbar, Assistant Building Inspector. Make the motion to award bid and authorize.
Second.
All in favor?
Aye.
So moved.
So that total,
Yeah,
150,000.
yeah.
So
Close to-
we basically have to pay for that and we put a lien against the property, but there's probably no hope of the property ever recovering or being
Wow.
of value.
Well,
Yeah.
it is a smaller piece of property, but who knows what will happen.
I mean,
down
there's
the
got to
road.
be an estate too. I mean, would we have recourse against the estate?
We should, right?
Well,
Mike?
Michael Tui, Abrams Fensterman LLP, counsel for the board. So I'm not familiar with what led up to because I'm assuming you either condemned it,
Yeah,
and you're
Building was
going to demolish it.
And in.
yeah.
There may be an estate or registration open. You'd have to conduct a search to determine enough to find the original owner's name and see whether anything's been opened.
I believe we have the original owners' names, but I think take me if I think they're deceased, one of them, right? And there's a level. We've gone out and tried to have family members look at the property and see that there was some interest, but based on how everything was set up, I guess, with the
And I believe the property's on the in-rem list.
yeah.
On the in rem. Okay.
It is.
So there's the cost of the condemnation, what you paid to condemn on the home, take the home.
There's
the
back
cost of
taxes there, right?
Demolition, taxes. I'd have to look to see whether you'd have a cause of action against the estate, but more importantly, whether there's any money in the estate. Because if there's nothing there, there's nothing to reclaim. Regarding whether or not the property has any value, I'd have to look at the lot and determine whether or not it can.
I mean, it's like a quarter acre in the middle of a 1 acre zoning, neighborhood. Probably couldn't even get a septic in there. You probably couldn't get health approval once you go through this process.
There's a lot of layers you'd have to overcome.
Yeah.
But there's also the potentiality that maybe an adjacent property may purchase it to add
Right.
up to their lot. That's a possibility.
Right.
Yep. Okay, on to number 6 here. Patty, we're gonna hold off on B for right now. We have just some extra questions we want to get resolved. A then, the proposal for planning review and development services from the Planning and Development Advisors, PDA, received January 8th, 2025, with an hourly fee scheduled at $165 for principals and $85 for technical support, effective January 1st, 2025 to December 31st, 2025. This is our planning and development. Dave Smith, who's been with us for quite some time and just carrying on again his contract with us. I'll make the motion to sign the agreement.
Second.
All in favor?
Aye.
Aye.
So move. And then C, let's move on to C here. C here is a 1-year maintenance agreement with Konica Biz Hub. This is for our copiers located on the 2nd floor of the townhouse with a monthly payment of $75.96 for 9,000 copies at spot 00844. This is from Tammy Saba, the Junior Administrative Assistant, effective retroactive to December 10th, 2024. Make the motion to enter into that 1-year maintenance contract agreement.
Second.
All in favor?
Aye.
Aye.
So moved. Patty, we do have a couple additional add-ons here. Number 7 here is the authorized letter to be sent to Westchester County for hazard mitigation plan update. We sent, I'd like to make the motion to authorize letter to be signed and sent to Westchester County.
Second.
All in favor?
Aye.
Aye.
So
Aye.
moved. Number 8, another add-on, authorize supervisors to sign a stormwater facility maintenance agreement for 28 Dr. Tony Road. Make the motion to authorize supervisor to sign.
Second.
All in favor?
Aye.
Aye.
So moved. And then also we'd like to acknowledge here today the promotion of Michael Ottamanelli to Assistant automotive mechanic at the Somers Highway Department.
Congrats.
Congrats on that. Parks and Rec, there's no additional business here for tonight. Financial, none. Highway, there's none. We just covered for the promotion. There are some current vacancies, Affordable Housing Board, Assessment Board of Review, and the Planning Board as well. And then we also have positions open on the Energy and Environmental Committee. They are still looking for some help on that regard. And then Planning and Engineering, there's no additional business. Police, no additional. Consensus agenda, make the motion to approve as presented.
Second.
All in favor?
Aye.
So moved. We do have some on our calendar coming up here. We did combine our February meetings. That's gonna be on the 13th, and that's the work session on our town board regular meeting.
So,
Regular meeting.
Patty, the special election to fill out the county George Latimer's term as county executive, that's on February that's a Tuesday.
Mhm.
And is there early voting on that?
Yeah.
Oh, 9, so it's the same as any other election?
Yes.
Okay, so, and that would be right here.
Be right here in the Alphen Hotel.
That's why we have to, got it, okay, just wanted to check.
Yes, and we also are having a public hearing for Trailside Estates, a residential development. And then again in March 6th and 13th, all times are at 7 p.m. Town board work session and town board regular meeting. We'll get to your fun. You want to do your fun fact now? Then I'll vote. I don't have. It's funny. I don't have the announcements today. Did she? I didn't. It's not in my. She probably put it on my desk, and I didn't go up there. Well, we'll skip the announcements unless I have them in here.
And put it on the website.
Well, they're right. Yes, they're all on our website
Yep, so.
as well. One of the things I will mention though is on February 6th. Normally the town does a parade for our state championship Somers football team. That is something is going to be a little bit done differently this year. On February 6th, instead of the parade, the Mario Cuomo Bridge, or some people might say the Tappan Zee Bridge,
Yes?
is going to be lit up in Somers colors
Oh, no kidding.
at 4:30. So if you would like to attend, let me get it here.
We'd be able to see it? It's not even dark then.
Yeah,
Sunsets.
yeah.
What
People
time,
are-
what time is it?
That is to arrive at Pearson Park at 4 p.m. arrival, and then the bridge should be lit up at 4:30. Hopefully it's
For how long?
dark. I don't know if it's for the night or
Why not?
I don't know for how long it'll be lit up, but that's something special, a little different, and I just got a confirmation on that as we were sitting here in this meeting.
So if they're going to do that, I wonder if the county, has that flashing board by the county center where they give out
Jumbotron.
days for people. And maybe they could make it Somers Tuskers State Football Champ Day and have that on that big
Jumbotron,
jump
We reached out to Fadat.
that day. Yeah, we got some contacts there.
we do.
I mean, it seems like that would be a no-brainer.
Mhm.
Guy though, you might not want to do it.
But we didn't beat them on the championship.
On the championship, we didn't.
No.
Maybe we'll pursue that, right? That'd be a good thing.
Yeah, nice.
Tusker Day in Westchester.
We burnt the
Mhm.
crop. We burnt the crop.
Or we see that guy running around in the corn cob costume.
Does anybody have anything other further else before we get to Patty's fun fact for the night?
I just wanted to mention, the passing of Marty Lohenfeld. She's a long-term resident of Heritage Hills. I got to know Marty through her work at Houlihan with Carol and some of the other folks there. She was just a wonderful woman. She was so energetic and well-liked, and she will be missed. I think there's a beautiful obituary of her in the record this week.
Bill, anything?
I think Patty's probably gonna cover it with some of our baseball related fun facts, but
Don't you still want to Patty's facts?
no baseball related. Mr. Baseball, Bob, you
Oh,
passed away. He was an source of entertainment for a lot of people and a lot of baseball fans for a lot of years. When it happened,
Well,
since our last meeting.
history. Yesterday,
Rich, how many days before pitchers and catchers?
I believe there are 4.
24 days. Wow.
I did want to mention, though, we're talking about sports, high school sports. Chick Mazuka, a long time resident of Westchester, grew up in Yonkers. He was the Nanuet athletic director. He is known throughout the sports community as a referee, and also a longtime baseball and softball player who has gone into the Yonkers Sports Hall of Fame with others. And he passed away. And, if you're in that sort of high school community, that it's a pretty big deal. He's a wonderful man. And as I said to some other people, like a lot of people here in Somers, he would have fit in really well. He was living in Briarcliff. When you saw him, he always had a smile. He just made you feel better being around him. He was always very positive. And, you need more positive people in life, and he was one of them. So we miss him.
Tom, anything?
I got nothing.
You said, Patty, fun fact before we close out.
So on this day in 1973, it was the 440th and final episode of Bonanza. On this day,
Us.
What year was it? 1973?
yeah, on this day in 1973, a scientist from the Corning Glass was granted a patent for optical fiber, beginning the telecommunication revolution.
Wow.
Standing.
About that.
Wow.
I like that one was Corning Glass.
Yeah. That's a nice place. You ever go there? It is a good trip. Yeah.
It's a great Italian restaurant there.
What a name for an Italian restaurant.
Luigi, good on Luigi.
Restaurants.
Luigi,
You wouldn't think it, but.
Super Mario. Well, that's all we have for this evening.
There we go.
So, make the motion to adjourn tonight's meeting.
Second.
All in favor?
Aye.
Aye. So moved. Night, everyone.
Thanks, Scott.